Yep.
All right, so we finished our treatment. I can take up the slack very freely, and I can induce posterior rotation through the pelvis. Same thing on this side. I can induce side glide. Side glide. It's heavy on your stomach. Here's superior spring. I can easily take up the slack to an end point where it stops, and then I can add an additional force, and there is joint play. Take up the slack, spring it, there's a spring and a recoil. Sacroiliac ligament, I can now give it a little bit of indent. Feels like rubber. Little bit of give. The sacrum, in relationship to the PSIS, now my left thumb, if I slide across, my left thumb overrides my right thumb. So the sacrum presents as being more anterior. If I take up the slack on the sacrum, now I can spring it and the whole body moves. That force translates through the whole body. I can induce anterior rotation. I can induce inferior glide. Line your back now, let's see what your head is doing. So I'm on C1 now. Side glide is very free. And now I'm doing traction as before, and I see your feet bob up and down. So your upper cervical reflexively released when we release mobility in the pelvis. Okay? Let's have you just walk up and down there and give us some feedback.
Yeah, it feels freer.
Feels freer?
Yeah.
Very good. Good. And how does your neck feel?
Good.
What does good mean?
Like without tension, I guess I
Good.
would say.
I'll take it without tension. So this was a demonstration of the pattern that I call posterior glide of the sacrum. And it's based on movement testing, but also based on palpation of position, but mostly based on movement testing. And we find a rigid pelvis where there's no ability to take up slack in any direction, no ability to create spring, recoil, mobility through the pelvis, also with a compensatory pattern in the upper cervical spine. We did nothing to treat her upper cervical. We only treated the pelvis based on a biomechanical model of restoring bilateral outflow of the ilium and anterior glide of the sacrum. And with that model, in 10 minutes, we achieved this kind of mobility in the pelvis and a reflex release of the tightness in the upper cervical spine. And our explanation of the model may change. You know, no one has researched this. No one has done studies in which they implant titanium balls into the sacrum and ilium and measured before and after movement. No one's done that. Doesn't exist, might never exist. But in the clinic, it is a way of taking a rigid whole body, a body that's rigid in upper cervical and rigid in the pelvis, and changing that. And so the explanation might change. My model might be wrong of how it the explanatory model may change, but I hold that the treatment is very effective. Thank you.